Report?
Yes.
All right, it was a wild night on the floor last night,
Oh,
man. Hope
really?
you have a good day today. Okay, let's see, in room 14, we have a 78-year-old female, Mrs. Han. She was a widow. She was in an automobile accident a few days ago, drunk driver. She had a splenectomy. A couple days ago, she had an internal fixation device for her fractured pelvis. And she has a compound fracture of her right femur that was stabilized yesterday with 20 pounds of traction and 5 pounds of balance suspension using a Thomas ring and a Pearson parallel. You guys familiar with traction?
Yeah.
Okay. You need to make sure that that leg is hanging freely, that her foot is hanging freely when you go in there and check on her. Mrs. Han has only been in the States about 7 years, and she speaks very little English, understands very little English. Communication's been hard with her. She has 2 kids that come, and they're here all the time. They're not really involved in her care very much, but they're here all the time, like round the clock almost.
And do they speak English?
Yeah, they do speak English. Yeah. She's a heavy smoker. She has severe rheumatoid arthritis. She has CAD. She had a bypass grafting about 9 months ago. She's on Axid, prednisone, methotrexate, and let's see. Her vital signs are stable, but she's really little. She's only like 4.5 feet, 80 pounds. You have to be really careful when you move her because she just, you can throw her off the bed if you're not careful. So be careful when you're moving her.
Maybe we should get a nutritional consult up here.
Yeah,
that's a good
she
idea.
She hasn't been eating well either. Maybe some Boost. You can talk to the dietitian.
Okay.
That'd be good.
And is she on anything for pain?
Yeah, she's on 5 to 10 milligrams of morphine. I gave her about 6 mgs about 5:30 this morning.
Okay.
So.
Okay.
Anything else? Any other questions?
Sounds
Okay.
good.
You guys have a great day.
Thank you.
you.
Okay, I know the nurse went over the traction really quick with you guys. Are you guys familiar with the traction setup? Have you ever seen or dealt with it before?
Well, we've seen it in class, but we haven't really seen it in the hospital yet.
Okay, well when you go in there, you want to make sure that everything's working correctly. So first of all, you want to make sure her right femur is elevated off the bed about 45 degrees, and her foreleg needs to be parallel to the bed and resting in a sling.
Okay.
The next thing you want to look for is that the pulleys and the ropes are hanging freely, and there's no, knots or frays in the ropes. You want to make sure the integrity of the traction system is in good working condition. You want to make sure the weights are hanging freely, because if they're not going to be putting the right amount of traction on the extremities. The other thing that's important is that the line of traction is straight and in the same plane as the bone that it's pulling on.
Okay.
Okay. The last thing I would check for are if there are any bedclothes or objects in the way that are inhibiting the traction from doing what it's supposed to do.
Okay.
Okay?
Thank you.
If you have any questions, you can just come back and check with me.
Okay.
Okay?
Thank you.
You're welcome.
Good morning, Mrs. Han.
Hi, Mrs. Han.
I'm Katie. I'm one of the student nurses from Three Rivers Community College.
And I'm Jen.
I'm going to be assisting in your care today.
Yes.
Hi there. I'm Katie. Hi, Katie.
Hi, I'm Jen. I'm a student nurse. It's nice to meet you.
Okay, we're going to take your vital signs. Oh, we need to move
You
you
look
up
like
in the bed
you're
here.
down here. Can I just take this down for 1 second? No? Okay. We're just going to boost you down, or up, okay?
1, 2, 3. Just going to take your blood pressure.
Can I just get your pulse, Mrs. Han? I'm going to listen to your heart.
One 120/8. That's very good. Now we're just going to check your oxygen
count your respirations. Can I keep this down for a second?
98. Pulse. I'll take the one on the foot.
I'll check this foot.
I got 94. What did you get?
I got 92.
Okay, that time I got 92.
Okay.
Okay, and the traction looks good.
Yep.
Heels off the bed. Okay, we're gonna go report off to our instructor now. We'll be right back.
How did it go, girls?
Going good.
How's your patient?
She's good. Her vital signs are normal.
That's good.
She was a little low in bed, so we boosted her up and we checked the traction devices, and they looked fine for right now.
Okay, great. So what's your next plan of attack?
We're going to make sure that we don't put her at risk for anything else that she
Okay.
already is. And because she had the splenectomy, she's already at an increased risk of infection. She was a smoker, so she has decreased tissue perfusion and
Very
probably
good.
some pulmonary problems. The traction, she could get the pressure ulcers or watch out for deep vein thrombosis and skin breakdown. And she could also have an injury that could cause major stress on her heart while she's ambulating.
Okay, very good.
Some of the measures that we're going to take while she's here, we're going to try to prevent DVT by giving her plenty of fluids.
Okay.
I know she's on heparin therapy, so we're going to administer the anticoagulants. We're going to look for Homan sign, any pain or swelling, and also skin integrity. She's immobile. She's in bed.
Mm-hmm.
She is older, so we're going to look for any tearing, shearing, friction in bed. There could be possible complication of pneumonia because she's in bed, immobile. We're going to teach her how to cough and deep breathe. Constipation and urinary stasis could also be problems. So
Very
we're going to monitor her bowel function because after surgery that could be decreased. And we're going to try to find a comfortable way for her to get on the bedpan
Mm-hmm.
and encourage her to drink plenty of fluids.
Very good. Now, how is your mood and affect?
They were right. She really doesn't speak or understand much English, and her kids were a little weird. They were really quiet, not very friendly.
Oh, all right. So do you think there could be some cultural issues there?
I think there might be because I know she is a widow, so
Mhm.
I don't know, maybe because her husband's not there with them, and maybe there's some kind of head of household issue.
Okay.
But we could probably investigate that a little more.
All right. Maybe it would be good to have a therapeutic conversation with the children and see what you can find out about the
Sure.
culture and what's going on with the
Definitely.
family. Okay. Good job, girls.
All right, thanks.
All right. We're over here if you need us.
Okay.
Okay.
Thank you. Mrs. Han, I wanted to know how much pain you're in. Can you point out one of the faces and tell me which one you feel?
Oh wow, that's like an 8 out of 10. You poor
No, no,
thing.
no.
Oh,
Don't touch her head.
why not?
Because in our culture, that's where the spirit is said to reside.
Oh, I'm so sorry. Well, we'll go get you some pain medication to make you feel like this face.
We wanted to let you know that you can tell us if you're in any more pain. Here's your call bell. This is for us, this button right here, okay? This is for the light, okay? And this is for your TV. Can you point them out for me? Which one's for us? Which one's for me? Okay, that's good. And then your light, to get the lights? Okay, and then to watch your TV, it's up there, okay? Thank you.
Are you guys going to be here for the rest of the day, you and your brother? Okay, we'll be right back. So, can you tell us what we can do to make your mother more comfortable?
You can touch her hands, but don't look right into her eyes. It's aggressive.
Okay. What about as far as touching her feet? Is that okay?
Yeah, that's okay.
Okay. Would you guys like to learn about how to care for her right now while we give her her bed bath and change her linens?
Okay. Well, we can at least show you so you can be an active participant in her care, okay? Okay.
Bath water here. Do you want to tell her?
What we're doing so we don't frighten her.
Okay.
Mom, they're going to give you a bath.
Okay. So let's start with inspecting the skin.
Her ankles don't feel swollen at all.
Okay. Check your calf.
Does this hurt at all? Pain?
Can you feel me moving your fingers?
Does this hurt? No? Okay.
Okay. Cast is okay.
Okay.
But that pin looks a little red to me. Doesn't it look a little red to you?
It does look a little red.
Okay, we'll have
There's
to
no
tell Mary.
discolor discharge or anything. But it does look a little red.
No odor.
We'll have to tell our instructor.
Okay.
Did we check her IV site?
Sure did.
Okay. Doesn't look like any inflammation. Looks fine.
Okay. Well, let's get you washed up and your linens changed, and then we'll go get our instructor.
Hello, girls. How's it going in here?
Well, we
It's
just
doing
finished
good.
washing her up and changing the linens and doing her oral hygiene.
She did okay with it.
Good.
And
We were just noticing on one of the pin sites, it's a little red. We wanted you to take a look at it. We didn't notice any discharge or foul-smelling odors, but it was just a little red, so we wanted you to look at it.
Okay. Did she have a temp when you took it?
No,
Okay.
everything was stable.
And did you get a chance to look at her lab values?
yes, they were all normal.
Yeah.
So her, okay, good, good. Maybe what we might want to do is make a little outline of it to assess in a while to see if it's spread at all.
Okay. Do you want us to do some pin care now, or should we go get supplies?
Yeah, that would
Okay.
be a really good idea.
Okay.
Okay, everything else is going fine? Anything
Yeah.
else? Okay.
I just love working with her.
Oh, that's wonderful,
Yeah.
good. It's nice to have a good partner, isn't
Yeah,
it?
good teamwork.
That is good. That's great. Okay, great.
All right, I'll go get the supplies then.
Okay. How's it going, Jen?
It's going all right, but Mary, this is the second week in a row you paired me with her, and I just really don't think I can work with her anymore. She just picked up an IV line off the floor and connected it to our patient. I mean,
Oh.
how irresponsible is that?
Did she wipe it with alcohol?
No,
Okay.
it was horrible. I can't. I don't even want to work with her anymore.
I'll have to speak to her about that.
Yeah, I think you should. This is
Okay.
ridiculous.
All right. I'll speak to her about that.
Thank you.
You're welcome. So, Katie, how's it going today?
It's going wonderful.
Oh, that's wonderful. I'm glad to hear it. Jen brought up a couple concerns that she's having with the patient care today.
Oh, okay.
I was kind of hoping we could discuss it.
Yeah, sure.
Okay. There was a little incident about the IV line where you had gotten that from before you put that in the patient's arm.
Oh, it was already intact.
It hadn't come from the floor.
Maybe.
Did you wipe it off or clean it or put new tubing on before you put that in the patient's arm?
No. I think
Okay.
I forgot.
All right. All right. Well, when you get home, I want you to write up a little occurrence and bring that in for me next week.
Okay.
That's okay. It doesn't.
It's not my fault.
We all
I
get them,
was
yeah.
drinking last night. I didn't really get to bed this morning.
Oh, yeah. So, do you feel like you're not properly prepared for today?
Oh, no, I'm good.
Okay. All right. I think we'll be watching. Maybe I should help out with the care for the rest of the day.
Okay.
Okay? All right.
I'll do the discharge part. Tell her, like, yeah.
Okay, girls, how did your rest of your day go?
It went okay.
Good. And Katie, how are you feeling?
Much better. I had some coffee.
That's good.
Thank you.
I'm glad to hear that. I'm glad to hear that. We just want to touch up a couple things in post-conference. Now, Jen, there was a problem with the traction.
Yeah, we went in there and there was a knot in the pulley and the weights didn't seem right to me. So
Okay.
I talked to a nurse on the floor and she said something about calling a traction tech. So
Okay,
we called
great.
somebody, they came up and looked at it and kind of fixed some stuff for us, so it was fine. We checked our alignment and everything looked fine to us.
Great, great. Okay, and Katie, did you go over some discharge planning with the patient and the family?
I sure did. I told them about one of the support groups that the hospital offers. I gave them a couple of websites to go to, and then we also printed them out all of the discharge instructions
Excellent.
so they can interpret those to her.
Okay, and how about some teaching plans for the patient?
We taught her about the coughing and deep breathing and using the incentive spirometer, and she needs to report any pain that is worsening or any discomfort that she's feeling that isn't being relieved with the narcotics that she's discharged with, about drinking plenty of fluids, and we called in the nutritional tech to come and give the consult, and she helped her form a diet plan to follow.
Okay. All right, let's talk about a couple issues that we have with her already being a little underweight and blood loss due to the surgery. What are some signs of bleeding that we would be concerned with?
Well, her PTT was within the normal therapeutic range.
Very good. I'm glad you
So-
checked that out.
We just kind of assessed for pain and swelling. That could be signs of hemorrhage.
Excellent.
Checked her sensation. That's pretty much it. She didn't feel any tingling or swelling, and we checked her ankles, and everything looked okay around her calves.
Very good. So how was her iron levels?
Her iron levels were normal.
Okay.
We checked her H&H and her RBC count, and those were normal too, so everything was
good.
stable for now.
Okay, great. Very good. Now we found that little spot on her pin site.
Mhm.
What other things would we be looking for infection?
High temperature, a raised white blood cell count,
Okay.
any odor or permeant drainage coming from it.
Okay. What would we do to combat? What would we do to be proactive to stop infection?
Increase her caloric and protein intake.
Very good.
Good pin site care.
Okay. Have we been monitoring her glucose?
Yes.
Yes.
Okay,
Her
very good.
agency protocol.
Very good. Very good. Okay, one other thing we should discuss before we leave for today is fat embolisms that can occur. Can you guys give me some signs and symptoms that we would look for in a fat embolism?
Sure. Some of the signs and symptoms are shortness of breath, rapid heart rate, fever, confusion, petechiae on the chest, axillary folds. Look at her conjunctiva and her retina. We would want to also listen to her lungs for any adventitious breath sounds. We just want to support her airway.
Okay. How about for a pulmonary embolism?
We want to look for any dyspnea, anxiety, fever, tachycardia, cough, diaphoresis, syncope, and sudden and pleuritic chest pains are common.
Do you guys have any other issues that you want to talk about from the day?
I think we did okay because it was a little hard with the communication. And,
Okay.
you know, our kids, we kind of got her daughter involved in some of the care, so that was good.
Excellent.
But that was a little bit difficult, a new thing for me, and you know, it was good to have that experience to be with a person who didn't really speak much English.
Okay.
And I'll get to that clinical occurrence as soon as I can.
Yes, I'm sure you will. So everything else went okay?
Oh, yeah.
All right. Very good.
Thank you.
See you next
Thanks.
week, girls.
Okay.